Hello, everyone. Today, we are going to discuss a topic about dysbiosis in infertility women. It is estimated that infertility affects approximately 1/6 of the global population, making it a significantly global public health issue. More and more research suggested that GANT dysbiosis is associated with the occurrence and development of infertility. Now, let's have Professor Pang introduce what is GANT dysbiosis.
Okay, I'm very pleased to have this chance to discuss the topic of GANT dysbiosis and the infertility with all of you. GANT dysbiosis refers to an imbalance or disruption in the composition and the function of the gut microbiota. The human gut harbors a vast array of microorganisms, outnumbering human cells by tenfold. These microorganisms include bacteria, fungi, viruses, and more. They play crucial roles in digestion, immune system regulation, vitamin synthesis, and so on. Research suggests that when the gut microbiota is imbalanced, it may lead to various health issues, include digestive problems, inflammation, immune system dysregulation, obesity, diabetes, allergies, and even mental health disorders, cardiovascular diseases, tumors, and so on. Therefore, maintaining the balance of the gut microbiota is crucial for human health and deserves our utmost attention.
Indeed. Through Professor Pang's introduction, we understand the significance of GANT microbiota. So, how does the GANT dysbiosis occur?
Some of the factors that can lead to the imbalance of gut microbiota, these mainly include diet, medication, lifestyle, disease conditions, and other factors that cause changes in the intestinal microenvironment. Diet is a major factor influencing the gut microbiota. Changes in food composition, such as consuming high fat, high sugar, low fiber foods, and excessive intake of processed foods, can alter the relative abundance of specific bacteria, potentially leading to gut dysbiosis. In addition to diet, medication is also a significant factor. Oral administration is the most common route for drug intake, increasing the exposure of the gut microbiota to drugs, thereby causing dysbiosis. Meanwhile, some drugs exert their effects by altering the gut microbiota. For example, metformin improves type 2 diabetes by inhibiting Bacteroides fragilis, affecting bile acid and ceramide metabolism. Lifestyle factors such as stress, lack of exercise, and irregular sleep patterns may also influence the balance of gut microbiota. Certain diseases or treatments for diseases may have adverse effects on the gut microbiota. Moreover, genetic variations in humans can also affect the gut microbiota. For example, host intestinal HIF2 alpha induce dysbiosis by promoting lactate production. Overall, the complex interplay of these factors highlights the dynamic nature of the gut microbiota and its susceptibility to dysbiosis under certain conditions. Understanding these influences is crucial for maintaining gut health and preventing related diseases.
Yeah, we noticed that many factors can influence the stability of the Gantt microbiota. So, does this biosis of Gantt microbiota affect the reproductive system, leading to some reproductive health issue?
Oh, okay. The gut microbiota is considered a mature endocrine organ that influences distinct organs and the physiological metabolisms in the body. This basis of the gut microbiota not only affects energy metabolism, digestion, and the absorption processes, but also directly or indirectly influences the body's immune regulation, leading to the occurrence of various diseases. In the reproductive system, gut microbiota imbalance can lead to impaired sperm production, vitality, and quality in males. For females, gut microbiota imbalance plays a crucial role in the reproductive endocrine system throughout a woman's life by interacting with hormones such as estrogen, testosterone, insulins, and others. The gut microbiota is not only influenced by these hormones, but also actively affects the hormone metabolism, as observed by the decreased estrogen levels due to antibiotic usage. Metabolites produced by the gut microbiota may circulate and affect the female reproductive tract. That dysbiosis of the gut microbiota can also affect gamete formation, embryo development, and the fertilization processes, leading to ovarian dysfunction, polycystic ovary syndrome, infertility, poor outcomes of in vitro fertilization, and cancer. We have found a relationship between PCOS, a common reproductive endocrine disorder in women, and the dysbiosis of the gut microbiota. We have extensively explored its molecular mechanisms through high throughput metagenomic sequencing analysis. We used a group of Chinese PCOS patients. We discovered gut microbiota dysbiosis in these patients with a significant upregulation of gut bacteria, Bacteroides velcatus in PCOS patients. Upon the implantation of this bacteria, mice exhibited PCOS-like phenotypes, and we further investigated its mechanisms and elucidated the roles of the bacterial bile acid LC3 interleukin-22 pathway and the bacterial eigentermin gut FXR GLP-1 pathway in the pathogenesis of PCOS. These studies provide a solid foundation for understanding the impact of microbial imbalance on disease occurrence. In conclusion, the gut microbiota is crucial for maintaining human reproductive health. Research related to PCOS has revealed potential disease mechanisms and provided new avenues for treatment, indicating the necessary for further research in this field.
Okay, the significant impact of Gantt microbiota dysbiosis on the reproductive system, particularly in PCOS, raises the question: why does dysbiosis occur in PCOS?
Our research, along with others, indicates that there is dysbiosis in the gut microbiota of PCOS patients. However, the reasons behind the gut dysbiosis are quite complex, and we believe that the relationship between gut dysbiosis and the PCOS is likely bidirectional. The following aspects may affect the imbalance of gut microbiota in PCOS. First is insulin resistance. Many PCOS patients have insulin resistance, which can affect gut permeability and microbiota composition. And conversely, certain gut bacteria can affect insulin signaling, forming a feedback loop. And inflammation, PCOS is often associated with chronic low-grade inflammation, which also affects the gut microbiota. Inflammatory processes can alter the gut environment, promoting the growth of specific bacteria. And third, women with PCOS may have different dietary habits, which can influence the composition of gut microbiota. Especially a high-fat, low-fiber diet may lead to dysbiosis. And hormonal imbalance. PCOS is characterized by elevated levels of androgens, which may impact the gut microbiota. Microbiota can metabolize and interact with these hormones, affecting their levels and activity. And obesity. PCOS patients often have a higher body mass index, which is related to the changes in gut microbiota composition. So currently, research on gut dysbiosis in PCOS patients is ongoing, aiming to explore the mechanisms by which different gut microbiota affects PCOS and to uncover new therapeutic targets from the microbiota for the development of efficient and specific new treatment methods.
Now we understand that the causes of gut dysbiosis impacting reproductive disorders are complex, and dysbiosis can lead to various symptoms. Now, how do we diagnose and manage gut dysbiosis in infertility?
Okay, the research on gut microbiota dysbiosis in infertility is still in its preliminary stages. Diagnosing infertility patients based on different microbial characteristics or categorizing them into different gut types requires large-scale clinical studies to provide more comprehensive epidemiological evidence. In the future, with sufficient evidence, the abundance of gut microbiota may play a predictive role in the classification diagnosis of infertility and even fertility outcomes. And for the management of gut dysbiosis in infertility, it mainly include the following approaches: dietary adjustments and lifestyle changes, probiotic and prebiotic supplements, but those traditional interventions like specificity and widespread supplementation of antibiotics can disrupt microbial diversity and cause many side effects. Therefore, our team has developed targeted interventions aimed at specific microbial targets associated with PCOS, such as microbe host isozyme, to effectively and specifically alleviate PCOS without affecting the composition of the gut microbiota. So more research is needed in the future to advance specific microbe therapy.
Thank you. Thank you so much for the informative discussion led by Professor Pang. Looking ahead, understanding Gantt dysbiosis and its impact on reproductive health opens up exciting avenues for future research and therapies interventions. Precision targeting of Gantt microbiota and personalized treatment hold promise in offering new hope for infertility patients. Thank you all for watching and listening. Goodbye.